Dr. Zymantas, let's talk about, a fixed bridge, which is, you have a missing tooth or 2 or 3 missing teeth, and you replace them by using 2 healthy teeth to hang down a bunch of other ones. That's why they call it a bridge, I guess. And I have heard that while this is a very workable system and has been around for a tremendously long time and is wonderful in itself, there are some problems, not problems, but there's some more difficulties cleaning those teeth, or actually cleaning the gum and bone area, because the teeth are kind of melted or welded together and you can't go in between. You still can do it, but maybe slightly lazy or sloppy people like me might now stay away from doing it as regularly as they should, and maybe never. And because of it, gum disease develops in those areas, and because of it, that crown or bridge might fail, basically get bad, and needs to be replaced soon. And again, back to what we talked about, gum disease problem, during those years while that happens, you're having an infection in that area. Is that the way it is? And is that one of the reasons why perhaps an implant is obviously the more modern technology and is tremendously better?
Yeah, in most cases today, not all cases, but in most cases, a implant is more desirable than, say, connecting 2 teeth together with a dummy tooth in the middle called a bridge. If you just place, and the cost is relatively about the same in most areas. The implant, one implant with a crown and what's called an abutment is about the same price as a 3-unit bridge. So if you get a 3-unit bridge, it's definitely a lot more better for the long term, because you can clean in between the teeth significantly better. The bone in between the teeth pretty much stays stable, because you've got the implant kind of stressing the bone a little bit, which makes the bone stick around for a lot longer. And in many cases, you can make a more aesthetic and a better long-term restoration using an implant.
Okay. And so basically an implant lasts longer. Is that what you just said? I don't know. It kind of on an average lasts longer than one of those crown bridge type of thing.
Correct. And don't hold me to the facts here, but like a 3-unit bridge, the American Dental Association, I believe, says something like it may last like 9 years or something like that. If you have a properly placed implant, that implant may last you a lifetime if you can control the forces that are pretty much beating down on it, and as well as controlling the bacterial plaque that grows around the implant. So it very well may be a lifetime restoration.
I see. Well, that alone, you mentioned it's almost the same if you have to replace 1 tooth, and the cost probably it changes a little bit when you have to replace 2 or 3 teeth, but still, it's almost the same, and yet it lasts you quite a bit longer. So in the end, on the long run, it seems to be a lot cheaper.
Correct. Much cheaper. And the other thing is if say, for instance, you do lose 1 tooth, and the teeth on either side of the space are healthy, and the patient is very adamant about putting in a bridge, which is what we used to do routinely, say 10 years and before that, a long time ago, routinely place bridges. Nowadays, it would kind of almost bring a tear to my eye to have to cut down some of these teeth if they wanted to, because they didn't want to go through the implant. But that's, again, a informed choice that the patient makes. We present them with all their options, and everybody decides what is best for them.
Okay. All right. So, couple of cases on, why an implant might be better and not even necessarily more expensive, while yet a crown, a bridge, does the job as well. And, but the maintenance of it is obviously much more demanding than the one on on an implant, even though you need to maintain your implant like a regular tooth also, right? Otherwise the gum starts getting rotten anyway, right?
Correct. You just because you have no more root, you're basically, the implant becomes the root of your tooth, and you do have to maintain proper oral hygiene in order to disturb. Bacteria will start growing around on the implant, and if you don't clean it off effectively enough, then you can develop what's called peri-implantitis, which is an infection around the implant, and you may lose the implant if you're not effective in cleaning things around it.
And you need to be even more careful when you have a bridge because it's more difficult to maintain.
Correct. Yes, it's significant. Most people that have bridges do not clean in between the areas that are covered over with the bridge part. So because it is a maintenance, it does take more time, and humans are humans. We look for the path of least resistance. So in most cases they may brush well, but most patients will not clean very well underneath a bridge.
Well, thank you very much.